Hello, I'm Heather, and welcome to today's episode of Health Mantra with Manipal Hospitals. Today, we're taking a closer look at Parkinson's, a condition that affects millions but is often misunderstood. Imagine a condition that slowly changes the way you move and think. A world where everyday tasks like buttoning a shirt or walking across a room become increasingly challenging. Imagine waking up every day to a body that doesn't quite cooperate the way you want it to. Yes, it's overwhelming, but yes, there is help at hand. To tell us more, we have in the studio today Dr. Amrut S, a consultant neurologist at Manipal Hospitals, Goa. Hello, Dr. Amrut, and thank you for joining us here today.
Thank you, Heather. Hello, everyone.
With a specialization in neurology from Sir Gangaram Hospital, National Board, New Delhi, and a strong foundation in internal medicine from Tata Hospitals, Dr. Amrut brings extensive knowledge and expertise in treating complex neurological conditions, particularly when it comes to managing things like Parkinson's, dementia, and other disorders of the nerves, muscles, and spinal cord. So stay with us because today we're going to explore some key insights on degenerative brain diseases, early warning signs, treatment options, and so much more. Dr. Amrut, to begin with, could you tell us what exactly Parkinson's is?
So, Parkinson disease, it falls under the category of neurodegenerative diseases. Basically, neurodegenerative diseases are the diseases where the brain cells start dying and it starts presenting with the certain signs and symptoms. There are 4 lobes in our brain, in fact. Now, the neurodegenerative disease symptoms will start appearing based on what kind of a lobe is getting involved. So, when we come to Parkinson's disease, what is Parkinson's disease? Basically, we have dopamine secreting cells in our brain. Now, dopamine is the chemical which is responsible for smoother movements of our body parts.
The happiness chemical.
Yeah, dopamine is the chemical. So, when the dopamine secreting cells starts degenerating, then patients start throwing up the symptoms of the Parkinson's disease. There are 2 things. One is Parkinson's disease. Another thing is the Parkinsonism. Parkinsonism, it's an umbrella term basically. Under this variety of a Parkinson disease-like diseases will be coming. When we talk about the Parkinson's disease, it is basically the age-related disease. After the age of 60 years, due to the loss of these dopamine secreting cells, the body starts throwing certain signs and symptoms like motor symptoms and the non-motor symptoms. Parkinson is the disease which affects one side of your body. It starts from the one side of your body. Say it could be the tremor, or else it could be the stiffness, okay, or else it could be the slowness. These are the 3 classical symptoms where we say that these are the presentation of this Parkinson disease. But there are other signs and symptoms. What I would say is the warning signs, I could say. Like if some person is noticing there is a change in handwriting of the patients, okay, there is a decreased facial expressions, there is loss of smell sometimes, which we call as a non-motor symptom, and it could be the early symptom of Parkinson's disease as well. Change in handwriting, decreased movements and decreased facial expressions, stooped posture, these are all certain signs of Parkinson's disease which are very important to be noticed. And it has been said that even 10 years before the beginning of these symptoms, one might have experiencing some different sleep related issues. Dream enactment is the thing where into the deep sleep patients will start throwing their hands and all these things. This indicates that in upcoming 10 years, probably that patient will be ending up in having the Parkinson-like diseases. It could be constipation, it could be loss of smell. So these are the certain early warning signs which we should know about.
Doctor, you spoke about, slowness of movement, stooped posture. Now, these are things that are usually attributed to old age. So how exactly is Parkinson's diagnosed? Are there tests involved?
Definitely. These, as I have mentioned, these signs and symptoms are starting one side of your body. In fact, actually, the stiffness in one hand, tremors in one hand, entire generalized slowness of the movements, these are the early signs and symptoms of the Parkinson's disease. When we talk about the tests which are available for the Parkinson's disease, I would say absolutely there is no definitive test which is available right now. We can do the MRI scan or else the PET CT scan, TRODATs. These are the various modality of investigations. But clinical signs and the symptoms are most important here. Based on this, if we start these patients on a certain medicine by name levodopa, if they start responding for that particular treatment, then it becomes a kind of a diagnostic entity, I would say. If they are responding to the levodopa, it means that they are having the Parkinson's disease. And when we come to talk about this MRI brain, PET CT, and then the TRODAT, there are, as I have mentioned, there are a variety of Parkinsonian-like disorders which fall under the category of Parkinsonism. So there we can try to rule out the possible treatable varieties of these kind of a Parkinsonism. So that is the reason we usually do all these kind of a test in these patients.
Now, all of these tests, only a neurologist would be able to tell you.
Yes, definitely. So neurologist, as I have mentioned, it is a clinical diagnosis. So it is important for a neurologist to take the history, spend time with the patients, and then do the detailed examination, then advise the particular test. Because this Parkinson's disease will present in a different manner. Patients will come to you in different stages. And then the treatment is varied from the case to case basis. If based on the clinical history and examination, we will try to see whether it is a actual Parkinson's disease, which is an age-related disorder, or else it is some variety of Parkinson's disease. There are certain red flags what we usually look in these kind of patients, and then we take a decision. So in upcoming questions, or else in just in a while, we'll be discussing what are the treatable varieties of this Parkinsonism. We'll talk about that.
Doctor, you said something about stages. Can you tell our audience what are the different stages of Parkinson's, and how does it typically progress over time? Are the symptoms and rate of progression the same for everybody, or does it vary from person to person?
Yes. So when we talk about the stages of Parkinson's disease, for a layman, I would just say that it is a mild stage, moderate stage, severe stage, and then the advanced stage. Yes, for being a neurologist, I was a neurology resident. We used to group them into the particular category called as a H and Y staging, where we used to group them much better. We used to give a score of 0, 1, 1.5. But for a layman, what I would say, mild disease is the disease where we are seeing the classical symptoms of Parkinson's disease, but activities of daily living. What I mean, like he is able to do his work, he is able to perform the activities.
Daily tasks.
Yes. That is the category of patients which will fall into the mild stage. When we talk about the moderate and then the severe stage, they will start requiring someone else support for their household activities. And when we talk about the advanced stage, the florid or else the severe or else the advanced stage Parkinson's disease will be almost bedridden. They will be requiring complete assistance. Sometimes they might be having a severe behavioral issues or else a psychiatric problems. So it could be the aggression, agitation, hallucination. They are one of the most
this is all in advanced stage.
All in advanced cases. Yes.
And how fast or how slow do you go from, say, your moderate to an advanced stage? What is the progression like?
Definitely. As I have said, patients might come to you in any of these stages. We'll be talking these things in the treatment modalities. Certainly, there is nothing that from mild to moderate stage, the patient will be going in so much of a duration. If we say this is a slowly evolving disease, Parkinson's disease, it probably evolves for about 10 to 15 years to reach to the severe and then the advanced stages. But it, as I have mentioned, it is again depends on the case to case basis. If someone is identified at the mild stage and then we have initiated the treatment, his symptoms can be controlled well. It also depends on what kind of a treatment he is on, uh, what kind of modalities are being used to treat him, what kind of a physiotherapy he is receiving, whether he was an active person or not, whether there were any risk factors were there or not, how were his eyes, how were his emotional status, how about his ears. All these things actually matter when he moves from the mild to advanced stage, in fact, actually.
So what would be, a normal course of treatment?
As such, there is a misconception in the public that Parkinson disease has no treatment and then the no cure. I would say that yes, definitely there are no disease or else no medications which can reverse the disease entirely, because it is an age-related process.
Yes.
The brain cells are dying, just the brain is shrinking because of the age. Definitely the lifestyle or else the living quality of living can be much improved by giving the treatment to the patients. So treatment depends again, basically brain is a complex structure. When we talk about the Parkinson's disease or some neurodegenerative diseases, the treatment is quite difficult here. Your patient needs to regularly follow up the doctor. It is not that like at certain point of a time patient has come and then I have advised him some medication and then there is no need of coming him back to me. Based on because we will be starting this treatment very slowly. If we start these dosages, say it as a levodopa medication, if we start them at the maximum dosage, and probably the patient will end up in throwing some other behavior related issues. So the treatment is slow. We will taper it gradually based on the follow-up visits. As such, there is no course or else no duration for which we have to treat them. We have to manage them symptomatically, basically. Along with the medication, we will be giving him a non-pharmacological things as well. First one would be the enhanced communication is important, and encourage the exercise. You establish a routine for them and then engage them in activities. So these are certain things which we have to add up here other than the medications.
Dr. Amrut, you spoke about how there is a misconception that Parkinson's is age related, and that is it not true that it only affects older adults? Can it affect someone younger?
Yeah, definitely. As I have mentioned earlier, that there are two things. One is Parkinsonism and another thing is the Parkinson's disease. Parkinson's disease is the disease of old age after 60 years. In fact, there is only one Parkinson's disease, the one which starts from one side with the tremor, slowness and then the rigidity, having a good response to the treatment like levodopa. But there are other things. We say it as a genetic Parkinson disease. Genetic Parkinson disease causing the Parkinson in younger patients sometimes, okay? And
as young as 20
yes,
and 30?
Definitely. Anything which is, anyone who is developing a disorders of this Parkinson symptoms less than 40-year-old, we call them as the young Parkinson's disease patients. There we have to look into the other treatable aspects as well. Sometimes some metabolic disorders like Wilson's disease, you say, in fact, actually, or else some genetic related issues can also cause this young Parkinson, which is a totally different thing, in fact, actually. So it is not the only disorder of the old age. The Parkinsonism can present in the earlier age group as well. But we have to evaluate them properly. That is the most important thing. You need to spend a time with them. You need to take the proper family history. You need to look for the genetic tests, I would say. You need to do the imaging. There are plenty of movement disorders which might mimic these kind of a Parkinsonism-like problems. So there is a chance that even the younger generation might start having these kind of problems. So they need a proper evaluation.
Now, you also spoke something about tremors.
Yeah.
Now, many people believe that tremor is one of, is like your set symptom. So if you have tremor, you have Parkinson's. But that is not the case, I believe.
Definitely. Yeah, there is a huge misconception that tremor is the indication of your Parkinson disease, or else the patients who are having tremor, they are having a Parkinson disease, or else some of the patients come to me and then say that, doctor, our patient doesn't has a tremor, but why you're saying Parkinson's? That is it could be a case of a Parkinson disease. As I have mentioned, there are three classical symptoms of the Parkinson disease. One is slowness of the movements, what we call as a bradykinesia. Okay. Number two is the stiffness, and number three would be the tremor. In fact, actually, it is not necessary that each and every patient will be having a tremor. Tremor is something which is a cholinergic symptom, what we call as a. To manage the tremor, we need to give them on a different medication.
Okay.
To manage the stiffness and then the slowness of activity, yes, there is another type of a treatment. So it is not only the tremor which is having we say that the tremor is the only sign of a Parkinson disease. Patients with the tremor might be having a certain treatable entities as well. Okay, so the one-sided tremor with the stiffness and then the slowness of movement, that falls into the category of treatment, and rest of the atypical features we have to again evaluate them.
But it's not the only sign.
Yes, exactly.
People also say, like I've heard of people say that Parkinson's is fatal.
Parkinson's disease as such is not a fatal thing. Yes, the mortality, what I mean that Parkinson patients might succumb just because of the immobility, or else, as I have mentioned, in the advanced stage, they won't be able to swallow properly. They might end up in getting some chest infections. By lying down on the bed, they are exposed to various infections, and by making them immobile, the disease will make them prone to get infections, and that is the most common cause of death in Parkinson's disease. Otherwise, if they are treated properly at the right time, the quality of life will be definitely good.
So basically what you're trying to say is that treatment and management of the disease is what's important.
Exactly, yes.
If you want to say have some sort of longevity, then treatment and management of the disease.
Exactly. Yeah.
But are there treatable varieties, or is it all diseases that have, say, no cure? People say that Parkinson's has no cure. Are there treatable varieties?
Yes. Again, coming to the topic of this Parkinsonism and then the Parkinson's disease. When we see some certain red flags and which tells us that no, this is not the Parkinson's disease. It actually the experience of your neurologist which counts actually here. If the disease is rapidly progressing, if there are certain red flags which indicate that here it needs a more and more evaluation. There are three things which I would like to mention here, which fall under the umbrella of the treatable Parkinson. One is normal pressure hydrocephalus. What is normal pressure hydrocephalus? In the old age, due to the pressure building inside the brain, there is a subacute. What you mean that there is a recent onset of the slowness of the gait, I would say imbalance, and then urinary problems again, and then the memory related issues. These are the three classical symptoms which are progressing, and when we get the imaging of, this is why the imaging is very important in case of a Parkinson disease. If we find out there are the radiological features which are suggestive for normal pressure hydrocephalus, by doing the CSF tapping, what we call as, we have to remove the cerebrospinal fluid from the body, the patients have a much more relief in their symptoms.
Okay.
So it should not be missed, number one. Number two, recent, I would say these are all the recent entities, what we call them as a autoimmune related problems, or else the paraneoplastic problems. Autoimmune, something which in our body, the antibodies are generated against the brain cells, and then they are causing the symptoms, because of which the symptoms are coming. Paraneoplastic, some cancer is hidden inside the bodies, and the antibodies are being synthesized, and they are affecting the normal structures as well. Among them, one important disease would be the IGLON5. IGLON5 is the disease. Now, this is the disease this is the antibody which is associated with the movement related problems, in fact, actually. And recently, study have been shown that the patients who are having atypical Parkinsonism features, I mean, the signs and symptoms are not fitting into the actual Parkinson disease. There, if they have done the antibody related things and they have found out some certain antibodies and they have used some immunosuppressant, what I mean by is the high dose steroids or the immunosuppressant, they were easily able to reverse the disease, in fact, actually. What it means, like, we will not, definitely by doing all these things, if even one patient is actually getting help, means it is lot for them, in fact, actually, because the care, the condition of these advanced dementia, where if they are left untreated in the beginning, then it is very horrible, basically. Number three is the drug-induced Parkinsonism. There are certain drugs name it as a, like, take it like a anti-emetic drugs. One of them would be levosulpride, and some people will be on atypical antipsychotics. There are some antipsychotic medications to control the behavior. The high dose or else the prolonged intake of these kind of a medications will cause Parkinsonism like features. Not only Parkinsonism, there might be any other movement related issues. So by trying to find out them in the early stage, we can prevent them from the prolonged morbidity.
Doctor, now I know you spoke about medication, but are there any other treatment options available, surgical or otherwise, in the treatment of Parkinson's disease? Have there been any advances made in the medical field?
Definitely. When we talk about any treatment modality or else the management of any disease, there are two things. One is the medications. Number two is the non-pharmacological or else the non-medication therapy. Number three would be the surgical therapy. It might be interesting to hear that there is a surgical therapy for the advanced Parkinson disease or else the challenging Parkinson disease also. When we talk about the medications, yes, there is a medication by name the levodopa or else the dopamine agonist, which will be tapering up and down based on the case to case basis. Number two would be the non-pharmacological therapy. In that, one includes the physiotherapy to increase the flexibility of the patients, to increase the mobility of the patient or the strength of the patients. Number three is the occupational therapy. We teach the patients to how to use the daily holding objects or else the utilities to improve their movement, all those things. In fact, number three would be the speech therapy. Other than this, coming to the surgical therapy, there is an entity called as the deep brain stimulation, where a device would be put into your brain which stimulates the area secreting the dopamine chemical. Now, the decision regarding the deep brain stimulation is taken by the neurologist. There are few indications for the deep brain stimulation, and again, as I have mentioned, here also the treatment would vary depends upon case to case.
Are there any potential risks to inserting a chip into your brain? Yes. For the purpose of DBS?
Yes, as it is a surgical modality, obvious complications would be existing, but the benefit would be more here. It could be the infection or else the device related issues or else compliance of the patient or else cognition related problems are the few important complications about this deep brain stimulation. But as I have mentioned, the benefit are much. The quality of the life of the patient would be much more better with this, in fact. And it is not in all the cases, in fact. Actually, it varies from the case to case basis. So that is why.
Doctor, you said something about dementia. Now that is another field that you also specialize in, and recent numbers have revealed that dementia is the 7th leading cause of mortality globally. Now, of course, it's a growing concern. Can you help our viewers understand what is dementia? What are the different types of dementia? What are the disorders that come under the umbrella of dementia?
So, dementia is not a disease, and it is not that dementia means always the forgetfulness. Dementia, again, it's an umbrella term, which is a manifestation of some neurodegeneration happening in our body. Again, it's the disease of old age. Before talking on to the dementia, there are two things. One is age-related dementia, another is the treatable or the secondary dementia. Before telling them that the patient is having a dementia, it is always important to rule out that he doesn't have this, he doesn't come under the secondary dementia class, because certain things like vitamin B12 deficiency, thyroid-related disorders, or else some vascular or else stroke-related issues are easily treatable kind of a dementias. When we say dementia, there are two things. One is minimal cognitive impairment, and then the actual dementia. The patient comes to you and then they start saying that, doctor, I'm forgetting, I'm having a forgetfulness, and I'm not able to recollect them, the things. So it doesn't mean that he's having a dementia. His activities of a daily living should be affected. It should be complained by the bystanders also that, yes, these are the instances where having these kind of problems. So dementia can present as, number one, A. It is not only the memory. There are A is altered behavior, altered language, altered routine of the patient.
What do you mean by altered?
Altered is there is a disturbance in his routine. What I mean, like he used to get what we while seeing the patient of dementia, we usually take the history since morning till evening, what the patient was able to do previously, earlier. Now how is it disturbed? Okay, based on that, we'll try to fit the things into what kind of a cognitive domain is getting affected here. So based on that, we'll try to fit them into the what type of dementia he's having. For that, we do certain memory related test, mental stability test actually. So it could be altered behavior, altered language, altered routine, or is the behavioral problems, or it could be behavior problems, or it could be difficulty in doing the task, difficulty in performing the task, especially the multitasking and all. Then F comes to be the forgetfulness.
Now we've spoken about symptoms. What about diagnostics, or what are the treatment? Are there treatments available to help manage the disease?
Definitely. So dementia, it is like a Parkinson's disease, I would say. As I have mentioned, based on the involvement of the lobe or else the structures getting degenerated, the symptoms, the patient will start throwing up the symptoms. Dementia management, when we come, there are two things: non-pharmacological management and then the pharmacological management. What I mean by these, the medicines. There are very limited medicines which are available to treat the stages, like the treatment with the medications is only possible in the mild as well as the moderate stages. There are different class of medications, what we call it them as acetylcholinesterase inhibitors. One of them would be donepezil, second would be memantine. So it is the thing. Here the non-pharmacological management also matters a lot. As I have mentioned earlier, enhanced communication. It is important,
so basically
that
talk to the patient.
Yes,
talk to the
patient.
family member.
Correct.
Yes.
Now it is your time that you're going to take care of them, because these dementia like disorders, they need a treatment more from the family members rather than a doctor. Doctor can help at a particular point of time, he can just adjust his medications and all. But first would be the enhanced communication. Encourage the exercise. Try to encourage them for the exercises, various exercises.
It like could be evening walk.
Evening walk, starting from the evening walk, engaging into the talks, or else going for some, as you have said, evening walk, or else doing some minimal physiotherapy and all these things. And that is the enhanced exercise. Engage them into the family members meetings, or else day-to-day routine activities. Say it would be TV watching, or else some smaller discussions. Okay, and establish a routine. A nighttime routine is important. These dementias are the disorders where the thing known as the sundowning happens. By the evening time reaches, they start throwing off the tantrum like thing, in fact actually behavioral problems, because the circadian rhythm, what I would say, I mean, this is the morning time, this is the afternoon, and this is the evening time. That is what very important. That is what it is actually starts getting disturbed in dementia.
So it affects sleep.
Yes, it definitely. So it is important to establish a nighttime routine for them. Stay away, you need to stay away from the disturbance. That there should be some light in their room so that they should not get disoriented. There should be someone who should be easily available to help them. So these are the things where we need to manage.
Doctor, one last question before we wrap up. The World Alzheimer Report 2023 spoke about preventative risk. So are there any things that we as individuals can do to take care of brain health? Preventative, I'm talking about, not once you've already, once you've contracted, say, the disorder, or once, I'm talking about when you're in your 20s, in your 30s, in your 40s. Is there anything that the public can do, our viewers can do to take care of their brain health?
Definitely. As you have rightly said, the prevention is the most important thing here. I'd like to put it in a proper way that number one, A is for avoid alcohol and then the smoking. Number two, B, blood pressure and then the blood pressure. Blood pressure and then the blood sugar. Control your blood pressure, check it often, and then next would be the sugar. Check your routine test at least 3 monthly or else 6 monthly. Have a good control over them. Number 3, stay connected. C means stay connected. Keep connected, keep learning the new things. learning the language or else the learning the some simple skill would be the best way here.
Basically, use your brains.
Yeah, you have to keep it.
Exercise.
Yeah, you have to keep it active. A, B, C. Number D, that is D is the diet. Most important thing would be the diet here. Mediterranean diet is the advised form of a diet for us. I know it is very difficult to follow the Mediterranean diet, but otherwise, simply having plenty of water, green leafy vegetables, fruits, dry fruits would definitely help them to have a good diet. In fact, actually, that would definitely add on to it. So 5E would be the exercise, which is most important thing. Exercise, a simple morning routine walk would add a lot here. In fact, actually, it's been said that 150 minutes of a walking is advisable for each and everybody.
150 minutes?
150 minutes of a week. In a week. It should be starting from the brisk walk. I mean, not the regular walk, I would say. 150 minutes of a walking is the best way to start your exercise related routine. F would be the fitness, G and then the H would be the good healthy lifestyle. These are the A to F solution or else the preventive measures what I can tell to protect yourself from the dementia.
So I think that was a very nice way to put it, Dr. A through F. So we have an entire list. Thank you so much. I'm sure our viewers have learned a lot today. If anyone has any questions or you would like a consultation, Dr. Amrut is available Monday through Friday, 10 a.m. to 5 p.m. at Manipal Hospitals, Goa. Thank you once again, Dr. Amrut, for sharing your knowledge and your expertise with us.
Thank you. Thank you very much. Thank you very much, Prudent Media. You're doing the wonderful job. Say it could be the updated news. Say it could be the health awareness, social or else the public awareness. It is. You're doing the wonderful there.
Thank you for your kind words.
Thank you.
It's been an absolute pleasure having you here on the show. That wraps up today's episode of Health Mantra with Manipal Hospitals. I'm Heather and I'll see you next time. Until then, stay informed, take care of your health and keep watching Prudent Media.